This segment is sponsored by cardiothoracic and vascular surgeons. Well, folks, let's talk hyperhidrosis, or abnormal extreme sweating that can be an embarrassing and serious problem. Here with solutions is board-certified thoracic surgeon here at CTVS, Dr. Rachel Medbery. Good morning.
Hi, good morning. How are you?
I am well, and I'm very excited to actually have this conversation with you because hyperhidrosis isn't just what someone like me would experience in the Texas heat. It's very different.
Right.
So talk to us about what causes extreme sweating.
Extreme sweating is usually caused by sympathetic overdrive. We have nerves in our body that complete that fight or flight response that we're used to hearing about, and that's what can induce that severe sweating that we see in hyperhidrosis.
Okay, so severe sweating that could potentially cause, embarrassment or implications for, social and professional interactions. Talk to us a little bit about what actually happens there.
So in hyperhidrosis, this is not your typical sweating that you have after like a really aggressive workout or a hot day in Texas. This is severe sweating that patients will usually experience on the palms of their hands, their armpits, or the soles of their feet. And we see it in these patients where it impacts their daily lives to the point where they can't do simple, basic tasks.
Okay, so we're seeing, examples of people who I know talking to you before this maybe couldn't drive as well, or teachers who can't write on a whiteboard. Tell us a little bit about that.
Right. So, for example, patients will sometimes come in and say, driving my car, my hands like slip on the steering wheel. I can't grip because I'm so sweaty. Or somebody who has a desk job and needs to type on their computer all day long might say that they have to constantly wipe off their keyboard. In the pre-COVID area, when we were all shaking hands, patients would avoid shaking hands with other people because it was embarrassing to have just a constantly wet hand.
Okay, so there are solutions and there are treatments for this. So this is the good news here.
Yes.
First of all, I want to talk a little bit about that. And then I also want to know, when someone is experiencing hyperhidrosis or extreme sweating, at what point do they say, hey, I need to seek medical attention?
So I'm going to answer that question first. I think anybody should seek attention when it's impacting their daily life to the point where it's impacting your job, it's impacting your ability to do things like drive a car, like we just talked about. If it's causing you social stress, impacting your self-esteem, that might be a reason to go see someone. And with regards to your question about what to do about it, there's a full range of things. Oftentimes people will start with a topical agent like a deodorant, stronger than your normal deodorant that you would buy at the store. But then there's also treatments such as Botox. So dermatologists can actually do injections to try to help with hyperhidrosis. And then there's surgery, which is what I do.
So I do want to talk a little bit more about what you actually do. Tell us a little bit about the surgery options first.
Surgery is a minimally invasive surgery. It's called VATS, or video-assisted thoracoscopic surgery. And it's a bilateral VATS sympathectomy, where we go in, we make 2 small incisions, smaller than 5 millimeters each, and we go in and we interrupt what's called the sympathetic chain that drives that sympathetic drive that we talked about at the very beginning. And interrupting that chain at certain spots can actually decrease the amount of sweating that a patient will experience.
Now, with that treatment, is there downtime, or how does that actually work?
There is. So it's a same-day procedure. You come into the hospital, you're usually able to go home the same day, and I tell patients to expect about a week or so of downtime. The pain is pretty minimal. Most of the time patients are able to just take over-the-counter painkillers. Sometimes we do need some prescriptions, but for the most part, people are back at work within about a week.
Okay, I'm so glad to hear that there are solutions here. Before we go, can you tell us just a little bit about your practice and who you guys are, what you do?
Sure. So cardiothoracic and vascular surgeons is a group of physicians here in Central Texas. We take care of everything related to the heart, the lungs, the chest, all your blood vessels. We are one of the largest private practice cardiothoracic groups in the country. I am the first and only female in the group, so I'm super excited to hold that title, but that's what we do for our patients here in Texas.
I love to hear it, and I love the girl power
That's
here.
Right. That's right.
Dr. Medbery, thank you so much for your time. I really appreciate it.
Oh, you're welcome. Thank you.
For more than 60 years, CTVS has offered Central Texas the most specialized and innovative cardiothoracic and vascular surgical care available. To learn more, go to ctvstexas.com. This segment is sponsored by cardiothoracic and vascular surgeons.